Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Cystic fibrosis. Introduction. Cystic fibrosis is a rare disease of the body's mucus glands that can run in families. It can affect people of any race or ethnicity, although it most commonly affects Caucasians or those of Northern European descent. Cystic fibrosis is a serious disease that affects the respiratory and digestive systems in children and young adults. The sweat glands and the reproductive system are also affected. This program will help you understand what cystic fibrosis is and what causes it. The symptoms, diagnosis, and treatment of cystic fibrosis are also explained. Cystic fibrosis. Cystic fibrosis, or CF, is an inherited disease of the body's mucus and sweat glands. CF does not go away. It gradually gets worse over time. The current average life expectancy for people with cystic fibrosis is about 37 years. Some people live into their 40s and 50s. Our bodies have special cells that secrete mucus and sweat in order to function normally. Our lungs also have these special cells. The mucus is watery and helps trap dirt and germs that we breathe in and push them outside of the body. Mucus also lubricates the respiratory, digestive, and reproductive systems and prevents them from drying out or getting infected. Mucus in patients with cystic fibrosis is thick and sticky. It collects in the intestines and lungs. In the lungs, this sticky mucus can block air passages called bronchioles and lead to infection. Patients with cystic fibrosis typically do get lung infections or pneumonias more commonly than others. The sticky mucus in the intestines means they have problems digesting food, which leads to poor growth. Sweat helps to keep our bodies cool. People with cystic fibrosis lose a lot of salt when they sweat. This can upset the balance of minerals in the blood, which may cause abnormal heart rhythms. Causes. Cystic fibrosis is an inherited or genetic disease. Genetic comes from the word gene. Genes control traits or functions of the body. In cystic fibrosis, the patient has a defective CF gene or a gene mutation. A defective CF gene makes it hard for chloride, a part of salt, to move through cells. This causes abnormal mucus secretions and salt loss in the body. A CF gene is defective if a child inherits two abnormal genes, one from each parent. The child's parents are then called CF gene carriers. That is why even if parents do not have cystic fibrosis, their child could still have it.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Symptoms of cystic fibrosis vary from child to child. A baby born with cystic fibrosis usually has symptoms during its first year, but sometimes symptoms do not show up until later in childhood or the teen years. Infants or young children may have diarrhea or large, foul-smelling, greasy or mucousy stools. They may also have the opposite problem, severe constipation or rectal prolapse. Children may also have frequent wheezing, pneumonia or a chronic cough with thick mucus, poor growth. When babies are born with an intestinal blockage called meconium ileus, it could be a sign they have cystic fibrosis. Meconium ileus is caused by buildup of the thick, sticky stool that is the baby's first stool, blocking off the end of the small intestine. This occurs because the mucus in stool in patients with cystic fibrosis is thick. Mucus can build up and cause blockage anywhere that it collects. It builds up quickly in the intestines and lungs. Symptoms of cystic fibrosis are mostly due to thick mucus. There are other symptoms and problems that are associated with cystic fibrosis. These include swollen infected sinus passages, also called sinusitis, nasal polyps, which are non-cancerous growths inside the nose that can block the sinuses, rounded and enlarged fingers and toes, called clubbing, coughing up blood, rectal prolapse when the rectum sticks out of the anus, abdominal pain and discomfort, too much gas in the intestine, infertility, especially in men, liver disease, diabetes, inflammation of the pancreas or pancreatitis, gallstones. Diagnosis. Your healthcare provider will ask questions about your personal and medical history. He or she also will perform a physical exam. Certain tests will be ordered to diagnose cystic fibrosis. The most common test for cystic fibrosis is called the sweat or sweat chloride test to measure the amount of salt in the sweat. Patients with CF have a high amount of salt in their sweat. In the sweat test, an area of the skin, usually the forearm or leg, is made to sweat. The area is wrapped with a device that collects the sweat that is produced. After 30 to 40 minutes, the collection device is removed and the sweat is analyzed. Higher than normal amounts of sodium and chloride suggest that the person may have cystic fibrosis. The sweat test may not work well for newborns because they may not produce enough sweat. In the U.S., all states perform a screen for cystic fibrosis as part of the newborn screening testing. After a baby is born, the nurse draws a little blood from the baby by poking the heel. The blood is then placed on spots on a card and analyzed for a few genetic conditions. The results can take up to 4 weeks to come back. A small percentage of people with cystic fibrosis have normal sweat chloride levels. They can only be diagnosed by genetic tests for the presence of the abnormal gene. Some other tests that can help in the diagnosis of cystic fibrosis include chest X-rays, lung function tests for children over 5 years of age, sputum or phlegm cultures. Stool samples may be needed to help the healthcare provider to know if the digestive system is affected by CF. Treatment. For most cases of cystic fibrosis, there is currently no cure. Treatment is focused on improving nutrition, reducing symptoms, and slowing down the progress of the disease so the patient's quality of life is improved. Breathing treatments, exercise, and medications can help the lungs work better and lower the risk of infections. Antibiotics can treat bacterial infections. Medications can also lower the amount of salt lost in sweat. A lung transplant may be an option for people with advanced cystic fibrosis. Other types of surgery may be recommended depending on the specific complications. The digestive problems in cystic fibrosis are managed by taking pills called pancreatic enzymes with each meal. Pancreatic enzymes help those with cystic fibrosis digest what they eat. A well-balanced, high-calorie and high-protein diet is often prescribed. Vitamins A, D, E, and K are given to ensure good nutrition, as those with cystic fibrosis do not absorb these specific vitamins as well as those without cystic fibrosis. Sometimes a feeding tube can help patients get the nutrients they need. Medications that soften stools to reduce problems with constipation are also often prescribed. When constipation occurs and causes intestinal obstruction, medications that further soften the stools as well as enemas are used. Screening. Any couple can request to have genetic screening for cystic fibrosis to see if they are carriers. This is encouraged if there is anyone on either side of their family with cystic fibrosis. If they are carriers, they are counseled regarding their chance of having a baby with CF. A pregnant woman can have tests to find out if the baby she carries has cystic fibrosis, but the commonly used screening tests do not detect all the mutations known to be associated with cystic fibrosis. If there is another child with cystic fibrosis in the family, the expectant mother may request a prenatal test to see if the fetus has cystic fibrosis. There are two prenatal tests that can be done to check for CF, amniocentesis or chorionic villus biopsy. In amniocentesis, cells from the amniotic fluid are tested to see if CF genes are present. Amniocentesis is usually done at 15 to 20 weeks of gestation. In chorionic villus biopsy, cells from the tissue that will form the placenta are tested for the cystic fibrosis gene. This test can be done earlier than amniocentesis, generally at about 11 to 12 weeks of gestation.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cystic fibrosis is a serious disease that affects the respiratory and digestive systems in children and young adults. The sweat glands in the reproductive system are also affected. In cystic fibrosis, the patient has a defective CF gene or a gene mutation. A defective CF gene makes it hard for chloride, a part of salt, to move through cells. This causes abnormal mucus secretions and salt loss in the body. Symptoms of cystic fibrosis vary from child to child. A baby born with cystic fibrosis usually has symptoms during its first year, but sometimes symptoms do not show up until later in childhood or the teen years. Treatment is focused on improving nutrition, reducing symptoms, and slowing down the progress of the disease so the patient's quality of life is improved. Any couple can request to have genetic screening for cystic fibrosis to see if they are carriers. This is encouraged if there is anyone on either side of their family with cystic fibrosis. Learning about cystic fibrosis is important for patients and their families in order to cope with the physical and emotional effects of the disease. Patients with CF can lead active and fulfilling lives.
Thank you for using Explain.